Welcome back to Research Connection. Today I'm here with Dr. Sarah Ozawa, and she is an assistant professor in our Department of Clinical Sciences, and she's going to talk to us about exotics, medicine, and research. So your research varies greatly in species. Just looking at your list of publications, there's kangaroos and corn snakes, rabbits. How's it being in a field where you have to have like a varying level of understanding of all these different types of species? What are some of the challenges that come with that?
I would start by saying I would argue it's so much more exciting. I don't have to pick one. And I think the nice thing is a lot of this framework has already been laid out for us in canine, feline, equine medicine. I think in some aspects exotic medicine is maybe a little bit behind those other areas just because how often do you see a kangaroo in practice? Probably not as often as we see a dog. So a lot of these studies that we're doing in these species, many of them have the framework from an anatomy, physiologic standpoint, a therapeutic and diagnostic standpoint in other species. So a lot of it is extrapolation and saying, hey, we use this diagnostic modality in a dog, what does this look like in a corn snake? We use this drug in a cat to treat this disease, how might this work in a rabbit per se? So really, once you take away the species, the research framework is the same no matter what type of animal we're dealing with. But I think really has given us a lot of areas that we can continue to grow by learning from our colleagues in other fields as well.
So you recently collaborated with Dr. Lubar and a few of our students in the exotics field on a study looking at the treatment of fish hook injuries in freshwater turtles. From what you observed in that study, what are these injuries doing to our local wildlife here in North Carolina? How can we help as citizens, our environment and our animals around us?
Absolutely, and I can't even take most of the credit for this. I think a lot of this was brought up by the students in the study. So Dr. now Hale had the main idea for this study, and then soon to be Dr. Kapp as well as Dr. Lubar came to me with this idea, and we as a group came up with this study. Fish hook injuries are a very common presenting complaint that they see in turtle team, of course, with the most common injury being oral hooks, which makes sense. They wanted what was on the end of that hook as well, didn't realize it wasn't targeted towards them. So they did a great study looking at over 100 turtles with this presenting complaint, which is the largest study to date on this presenting disease in this species. The good news is we did find that almost 90% of these turtles were released, and to our knowledge did okay. We're not sure what happened after release. But there were a fair number of turtles that developed complications. Hooks are not sterile. The oral cavity, the esophagus, those are not sterile locations. So several of those turtles did develop things like infection, complications even requiring enucleation of the eye. And one of the things we did find statistically associated was that those animals with complications did have a higher rate of mortality. So what can we do? I think the public already does a great job of recognizing that isn't right in a turtle and bringing them in for assistance. Many of these hooks do have barbs on the end, similar to as all fishing hooks do. So without knowing what you're doing in removal, just pulling it out can cause some trauma. So reaching out to a local veterinarian, or even better yet, our turtle team here, who is used to dealing with those all the time, is a great resource. I think other things to be aware of is just when you're fishing, how many turtles and other things are around, remembering that they could be an innocent bystander, and of course not throwing our fish back with hooks still present in there, as those can get stuck in the environment, can become eaten by the turtles as well.
So you also have an interest in cardiovascular research, particularly in rabbits. What are some of the rewards or some of the struggles of researching animals that aren't as well described as cats or dogs? What are some of the approaches that you take in that kind of research?
So for a lot of these species, we kind of have to start from the ground up. We don't even have that background for all the species we treat to say, not only how do we treat it, how do we diagnose it, but what types of diseases do these species get? So my previous study on a retrospective cardiovascular disease in rabbits, Dr. Kirsten Pierce and I recently, as well as Dr. Maritet, completed a study looking at types of cardiovascular diseases that bearded dragons get. Because I think that's step one before we even decide what sorts of diagnostics and what sorts of therapeutics do we possibly want to investigate. A lot of those diagnostics therapeutics that we are currently looking at investigating, such as we are currently validating a study to evaluate troponin, a measurement of myocardial or heart muscle injury in rabbits, which it seems like it works, so that's good. Same methodology we would use in a dog and a cat, and translate that to these other species. Because really, I think the standard of care for those animals with those diseases should ideally be the same as dogs, cats, horses, whoever else gets cardiovascular disease. But I think until we know what specific drugs we need to utilize at what specific dosage and intervals, we can't get there yet. The dosages of other drugs we need to use in rabbits, birds, and reptiles are sometimes vastly different than what we use in dogs and cats. So the doses we're clinically using in practice are oftentimes extrapolated, which is fair. We don't know what else to use for those drugs, but may be vastly inappropriate, might not be doing anything, or in some situations may actually be too high for the species in which we're treating. So my hope is by identifying these disease processes that we can in the future help better treat these patients and lead to a longer survival time in both our clients, our research, and our wildlife populations.